Good afternoon and welcome to another edition of Forever Young, the program that celebrates life for those of us who are over 40, maybe approaching Social Security, maybe receiving it. Who knows? All we know is that life is nothing but a number and you're as young as you feel. So we celebrate life in every decade, and you may be young and you may be more seasoned. I'm sure you're going to get something out of today's program. Of course, my name is David C. Linton, and I could not do this show without my able-bodied and great co-host. Now, we're going to be down one this week, so it's just me and beautiful. And of course, when I say beautiful, you know I'm talking about Jean Hendricks. Hello, Jean.
Hi, David. I'm excited as always to share this post with you. And of course, yes, I am young and seasoned. So back to you, David.
All right. Of course, there's usually a third person, and that's Dr. Sharon Mitchell. She's on assignment. So today, me and Jean will carry the show. But we're going to talk about something today that's very important. And of course, it's coming up in the news more and more these days, unfortunately, with all of the mass shootings. And that's something of talking about mental health. And so we at Forever Young are concerned about everything, because mental health is really not just for the young or for the seasoned. It's everybody. And so we're delighted to be able to bring back to you one of our guests from a previous episode. That's Dr. Yolanda Seals-Stewart. She's a native of New Orleans. She's the Chief Executive Officer at Alliant Behavioral Health, LLC in Marietta, and the Director of Project Growth Initiative, nonprofit arm of the company. She is fully licensed as a psychotherapist, trauma specialist, and certified professional counseling supervisor. And she's been in practice since 2005 here in the Metro Atlanta. There's more things we're going to tell you about our guests, but before we bring our guests to the show, Jean always has something, a little pearl that sets us on the right pace. So, Jean, what do you have for us today?
Yes, David, I have a little pearl today that's entitled Battle. You're the author of your life. So if you feel you can't cope, don't put a full stop on it. Battle through it and hope. You could give up, but instead you choose to fight. Battle is in the darkness until you see the light. Back to you, David.
Thank you, Jean. And that's right, the light. And that's what we're going to do, is try to shed a little light. Now, I've kept you in suspense, and we are going to bring to the stage now our guest for today, Dr. Yolanda Seals-Stewart. Welcome to Forever Young.
How are you guys doing today?
We're doing great. Great. So
Great.
good to have you. And thank you so much for coming back to be
You're
with
welcome.
us today to discuss things about mental health. You know, we talked about in my intro, we talked about, you know, mental health and, you know, all of the things. And I made a reference to shooting. And in looking at your bio, we see that your expertise was utilized in the Las Vegas shootings in 2018, and the nightclub shooting in Orlando in 2017, and the Sutherland Springs, Texas church shooting as recent as 2016. So we know that when we bring all those things up, you know, there's always conversations about gun control and all that, but what always seems to be the center of that is mental health. So we're going to talk about some of those things today, and hopefully you can shed some light on us. So before we get to that, let's talk a little bit about Project Growth Initiative. Tell us about your organizations, Project Growth and Alliant Behavioral Health.
Okay. Well, Alliant Behavioral Health, we are a mental health facility, outpatient facility, and what we do, we provide therapeutic counseling for individuals with serious mental illness, such as schizophrenia, bipolar, PTSD, as well as provide counseling for individuals with just, common depression and anxiety. We also provide assistance as well as counseling for individuals with learning disabilities such as ADHD and ADD. as well as substance abuse. We utilize various therapeutic approaches, and we can probably get into that later. And our mission is to provide quality healthcare with collaboration with other individuals. For example, if I have someone come to us and we see that they might need medication management, we have psychiatrists that we connect them with. Or if they need a psychological, we have someone who can do the testing for them just to make sure that they have the true diagnosis or if there's anything else that's going on. So we utilize all of that together to provide the care for our patients that's needed so that they can progress and get better and move from where they are. In regards to Project Growth Initiative, that was born out of Katrina. So I came to the greater Atlanta area as a result of Katrina. And when I would go back to New Orleans, where I'm originally from, the area where the barge broke the levee, that's the area that I grew up in. Matter of fact, it broke the levee down the street from my childhood home. So when I would go back to New Orleans, I noticed that the kids didn't have anything to do because the city was under reconstruction, of course. And my late pastor, Pastor Raymond Hunter Sr., donated one of his houses that he had for me to do something with the kids. So being homeless myself and not having anything at all, I took $100 that I had and I started the first after school program in the lower night ward to help kids. And I noticed when we were doing that after school program and summer camp program with them that the kids had a lot of psychological issues. So what I also started to do was partner them with individuals from the area universities and have those individuals provide counseling for those kids and support for those kids. It is still operating today. His son is now the pastor of that church, and they're still operating today. We provide backpacks for them, support the whole 9 yard. And I also do it here as well in Atlanta. Haven't had the chance to start back up here because of COVID, but we also provide those services here as well.
Can you be a little bit more? I'm telling you, she certainly is. Be a little bit more specific about your clientele. I hear you mentioning children and youth. Yes. So do you go beyond that age group?
We do. On the Aligned Behavioral Health side, we see adults ages 18 and up. With Project Growth, we see children as young as 4 years old. And we provide what's called, with the kids that are young, we have to do what's called filial therapy or play therapy with them because children have difficulties expressing themselves. So you have to be creative with the therapy, use a different type of therapy with those kids. But the majority of the children that we see are the kids that are having issues and have connection with DJJ, or kids that are have some type of post-traumatic stress going on. Some of the kids that we see have sexual assault trauma. We do not see kids with autism because that's a special type of therapy that they need. Mm-hmm. But however, we do work with kids who are severe or kids who have issues with emotional distress or emotion regulation.
Okay. You mentioned DJJ. So, what is that? What is that?
Department of Juvenile Justice. I'm sorry, Department of Juvenile Justice. Right. Kids who are coming out the system who are been incarcerated as kids. We help those kids as well. A lot of the kids that we help from that population are kids who had gang violence activities, who are dealing with other issues at home. So we work together with psychiatrists as well as other psychotherapists to make sure that these kids have the support that they need.
Oh, okay. Thank you.
Okay. So now, speaking of that, we talk about mental health, and especially with these recent shootings, which you've been, had to deal with some of those things. They're always, the first thing they say is, well, did you see the signs? And the first thing they ask about the profile of those individuals. So what are the warning signs that may indicate that someone may need to see a therapist or that they're experiencing some kind of mental health concerns?
Good question. One of the major signs is depression that lasts more than 2 weeks. If someone is severely depressed more than 2 weeks, was evidenced by them isolating themselves, constantly crying, feeling hopeless and helpless, meaning they don't see any reason to live or any hope for the future. If they feel helpless, like making statements like, oh, I will never get better, or I will never be this, or I can never do that. Periods of extreme anxiety, worrying, constantly worrying about things. Appearing to have a dark side. For example, saying things like, oh, this world is going to end soon, or, oh, my life isn't worth living. Having plans to not engage in activities, becoming more isolative, having thoughts of suicide, for example, have a plan and an intent, or there's what we call passive suicidal ideation, making statements like, oh, I hope I don't wake up in the morning, or if the Lord takes me tomorrow, I'm okay with that, or I hope I go to sleep and don't wake up at nighttime. Signs like that are some of the signs that show that an individual has some type of mental illness going on or some type of severe depression that is going on.
Are you finding that people are truthful online more, or maybe not so much?
There's a lot of filters that women have. There's a lot of things that you really don't know that person until you actually meet them in person.
So, in other words, you guys are being catfish.
Definitely.
Dear moms and dads, we know it's not always been easy, and it's been a lot of hard work. What you have achieved here today is going to help us and our futures. It is why we are coming up on stage to collect your diplomas. Everything I do it for you. Mom, love you always. No, it's true. Everything I do it for
When you graduate, they graduate. Visit finishyourdiploma.org to find free and supportive adult education centers near you.
An iMac computer, but you have a cell phone. Maybe you have an Apple cell phone. Leverage that to then create what you find important.
How do we make sure that our children, what they're learning, is positive?
So, older adults, now there are older people who live alone a lot. How will they know to be able to communicate with someone that they need help?
It's funny you will say that, because there are some statistics from NAMI, the National Association on Mental Illness, and some of the statistics show that 75% of individuals, older adults, or I call them golden agers, 75% of them who have completed suicide had seen their primary care doctor within 30 days before they completed suicide. It also stated that 63% of adults don't even get the services that they need that are older adults. It also states that in regards to primary care physicians, 50% of the adults who have mental illnesses don't get diagnosed by their primary care doctor. So recognizing the signs in older adults comes by them being depressed more than 2 weeks. If they're extremely isolative, as evidenced by not communicating with anybody by phone. I know we're coming out of COVID, but not communicating by phone, not communicating by FaceTime, being extremely isolative, not wanting to do anything at all, not want to get out with some friends or take a walk. And increase, one of the biggest factors, increase in somatic symptoms. For example, constant headaches, stomach aches, aches and pains. Those are some of the things that signal to professionals like me that there's something going on with that individual who is over the age of 65. Something seriously is going on with their mental health.
Okay, thank you.
Well,
that lets me know I'm okay, because I still
That's right, Jean. You're okay, and we're glad you are. Now, but I got like a two-parter here. Based on what you just say. Now, where do people go for help, and how do they find a therapist? People know that you need to get help, but there's also that phobia. There's a stigma.
Right.
So, where do you go for help, and how do you find therapists, and how do you know it's the right time to refer someone to do that? How do you go about that?
Right.
I know that's
Good
3 questions,
question.
maybe.
There's 3 questions. So first off, if someone is reporting that they're depressed for more than 2 weeks, having problems sleeping, eating, or isolating, or stating that their anxiety is high, if it's more than 2 weeks, you want to try to get them connected with someone who is going to provide services to them. So it's several ways that you can do this. For example, if they do not have insurance, each county in the state of Georgia and also counties wherever you live have a free mental health clinic. All you have to do is locate that free mental health clinic for your county, and you can go there free of charge if you do not have an income or if you are on a fixed income. Some of them require that you get there probably 7, 8 o'clock in the morning. Some of them require that you call before coming there and do an over the phone intake. But each county has free mental health clinics. So if you don't have insurance, you can simply call United Way and get the number for the mental health facility. For the mental health clinic in your county. That is one way. A second way, if you are employed, your employer offers what's called EAP. EAP stands for Employment Assistance Program. That is free counseling through your employer. Your employer will never know because it's a third-party vendor. So all you have to do is go to HR, get their number, and call EAP, and they will give you so many sessions per year, not only for you, but everyone who is in your household. Again, it is strictly confidential. Your employer will never know. HR cannot ask you why you call an EAP. EAP also cover other components. For example, if you're speeding down the highway and you pull over by a cop, you can call EAP and get free legal advice as well. Or if you need assistance with finding a good school for your child in a new area that you just moved to, you can call EAP for that as well. But that's absolutely free through your company. Another way that you can find a provider, if you have insurance, it's called your insurance provider. On the back of the card, there's a customer service number. If you call them and say, "Hey, I need a list of providers for mental health in my area," they will certainly email you, fax you, or either text you a list of individuals in your area for you to choose from.
Oh, okay. Very good.
Now that's very valuable information to know that
Eddie.
you can go with your employer to EAP, and even if you're pulled over by that's especially with all of that happening today, because people know, because especially people are traumatized when they're driving, especially African American, especially males.
Yes.
You're pulled over, adrenaline starts running, etc. So that's really valuable information that you've shared with us, Dr. Stewart. Jean, I know Jean has a question for you.
Yes, Dr. Stewart, tell us about the various types of therapeutic that you provide. And I have some here listed as CBT, DBT, ACT, and FBT. I don't know what those are. Tell us a little bit more about those.
Not a problem. Good question.
Yeah, it's an alphabet soup there.
Yes, that's what it is.
So here's something important for everyone to know when they're choosing a therapist or once they go to therapy. Just like when you go to a doctor's office or any other provider, they tell you how they're going to treat you medically. Therapists, psychiatrists, and psychologists have an ethical obligation to tell you how they're going to treat you. There are several therapeutic approaches. Some of the most common ones that we utilize is CBT, and I'll go through them: CBT, DBT, SFBT, ACT, Gestalt, and Adlerian. Those are the most common ones that we use. A lot of insurance companies prefer that we use CBT, so I'll tell you what those mean. So the therapeutic approach of CBT is cognitive behavior therapy. And that is basically all about mindfulness and helping you to think in your wise mind. And it connects your thoughts, your emotions, and it helps you change your perception of things. It helps you change the negative and destructive thoughts that you have going on in your head. The best way that I explain it to my patients now is that with CBT, we help you not to pull a Will Smith. So that's what that therapeutic approach is about. With DBT, that is dialectic behavior therapy. And basically what that is, that's a different form of CBT, cognitive behavior therapy. And it helps the patient to learn to live in the moment. this particular technique, we utilize that technique a lot of time with people with emotional regulation issues or individuals with borderline personality issues. CBT is normally basic depression, PTSD, somebody who have high anxiety. So that's the therapeutic approach we use for that one. SS and SAM, SFBT is solution focused brief therapy. And that's a form of therapeutic approach that we use. It is a short-term goal focused therapy, and it focuses on your strength and it focuses on your health. And a lot of time that's the form that's used in crisis intervention or EAP when you go to see someone, because EAP is short-term therapy. ACT is acceptance and commitment therapy. And basically what that is, you accept the life experiences as they come to you, as opposed to you evaluating them. You accept what's going on in your life in the here and now. It helps you to reduce pain and discomfort that comes from trauma and things that's going on in your life. So that's another form of therapeutic approach. A Gestalt is one that we utilize when we want to give you an assignment, or when we want to do a lot of role playing with you to kind of help you see things from a different perspective. And it helps you to look at your relationship to things that are going on in your life and what part did you play in it and what part you're not playing in it. Adlerian is another popular one. That's one we use when we're doing something that's mostly psychoeducational. When we're trying to make a connection with things and help you see what's your connection to things in society. Sometimes we as therapists will use just one of those therapeutic approaches, or sometimes we may use a collaboration of those. Before we decide which therapeutic approach we're really going to use and stick with, we get to know the patient first after the intake. So the first session is always the intake. Between the first and the second session, your therapist should tell you what therapeutic approach they're going to use with you, and as well as give you a handout as to what that looks like and what that's going to feel like, if that kind of makes sense.
We're going to let that marinate for 24 hours.
Today, we face an unprecedented crisis. Tens of millions of refugees have been forced from their homes. But you can make a difference. Turn disruption and despair to hope and opportunity. Even small amounts make a big difference. Provide shelter, support, or jobs in your community. The more we understand, the greater sense of belonging we create. Act now. Visit supportcrisisrelief.org.
What I tell my patient population is, before you can make any progression in anything where you've been hurt or offended, you have to make the decision to forgive.
Oh yeah, definitely. You know,
Thank you.
thank you for breaking down that alphabet for us, because that's
Yes.
because there are different things. Because it not only breaks down the alphabet, but it also definitely talks about the different approaches that one takes and things you can do. Now, you know, we always talk. If you're just joining us, you're tuning into Forever Young, and our guest is Minister Yolanda Seals-Stewart. And we're talking about mental health, and she is the director of Project Growth, and also the chief executive officer of Alliant Behavioral Health LLC here in the Greater Atlanta area, located specifically in Marietta. So, you know, we talk about these different things, and you know, I'm going to say this right now before I go any further. We've got a lot to share, and I want to right now see if we can get you to come back and do a part 2 of this show, because we can't get it all in the first 30 minutes. They only give us 30 minutes, so I know that we're not, you're giving us so much, but I want to shift it for a moment. You're a caregiver for the most part, and
yes, I am.
Always, and most people, caretakers and caregivers, you know. How has it been for you? How are you doing, first of all, and how has COVID, affected how you've been able to deliver your services to your clientele?
Well, there has been a shift in regards to delivering services. We have shifted to virtual, not only just behavioral health therapists like myself, but a lot of physicians and nurses. Um, we've shifted to online, and it's been quite interesting to say the least. It's challenging when we're seeing young adults and children because their attention span is so short. But however, it's very doable for adults to be able to see them online, because a lot of adults we see are like on their lunch break, or they'll run to their car. If they take a break at work, they'll come see us. So it's kind of it's easier for them. They don't have to drive across town. But seeing a lot of patients online it's been very interesting. We've had a huge increase in individuals that we're seeing now in private practice. Being a caregiver is interesting because you have to have certain characteristics in order to be able to help individuals. You have to be selfless. You have to be patient, compassionate. You have to be attentive. Have to have a very good listening ear and be non-judgmental. Have to be dependable. You have to be trustworthy. But to be a caregiver in this field, you have to literally, it's a calling. It's a true calling.
Yeah, and no, it has to be. I mean, it really, really has to be. And so that's why I had to pose that question, because, we always talk about the patient, but no one ever talks about the doctor. It's like it's just like in ministry. Somebody's always bringing their problems to you. So who do you take your problems to? Obviously, we can always say,
funny,
but,
funny you would say that. Funny you would say that because in some states, because one of my licenses is in Louisiana, in some states they require the therapist to have a therapist. And they do that, and they do that because your requirement is not to go to them every week. Your requirement is to check in with them with at least once or twice a month and just clear things out. So you have your own place to vent some things, because believe me, we have a lot that we deal with. And one of the techniques that they teach us in grad school, especially myself, when I was at Our Lady of Holy Cross College, one of the techniques that they taught us is literally when you're driving home from seeing a patient, or after you see a patient, literally put your favorite music on and roll down a window and literally throw everything out that you heard the entire day, because you cannot take that home.
Okay, wow. That's interesting. Yeah, there has to be some type of mythology. Yeah.
Yes, of course. Okay, now I'm going to ask you. I'm going to kind of shift a little bit also, and ask about depression during these times. That's a medical condition. It's called depression. And is that part of aging? Is that a normal part of aging?
Well, depression is a normal part of aging, and here's why. There are some medical condition that causes depression, or will cause you to have anxiety. For example, hypertension sometimes would cause that, as well as having diabetes, thyroid, something wrong with your thyroid that would also cause you to have some bouts with depression. But it is normal as you're aging, because you're losing people who are close and significant to you. There's a huge life shift. You're going into retirement. So the busy life that you used to have every day of being somebody else depending on you, that's kind of withdrawn, and you're feeling some kind of way about that. Kids are growing up and moving out the house. So you're feeling some kind of way about that as well, because you're going from a house of having a bunch of kids or grandkids where everybody's growing up and moving out. So it is common among individuals as they age and as they become older, but it is up to family members as well as that individual to find ways to make sure that they're still continuing to keep their minds occupied, or fill their days with something that's meaningful, or find a new craft, or find a new purpose, something that they can do every day, as opposed to them isolating.
Very good. Thank you. Yes.
Yeah, that's definitely good. Now, if our audience wanted to reach you, because I know we're running close to the end of this segment, how can our audience reach you if they wanted to get more information about you or your organizations?
Sure, they can reach me at 770-240-0932. And again, that number is 770-240-0932. 0932. They can call us Monday through Saturday. And if someone's not available, there is somebody to take a message, and we normally get back with you within 3 to 4 hours of your call, because a lot of times we have patients. They can do that way, or you can email us at admin, ADMIN, at Alliant, B as in boy, H as in Harry.com. And that's admin at AlliantBH.com.
Well, Dr. Stewart, we're so happy. Like I said, there's so much information that you have to give, and so many more things we want to get into. And I'm glad that you've agreed to do a part 2 for our audience to come back. But you're no stranger to the Hope TV audience, especially to those of us at the House of Hope Atlanta, because you have been a part of our family and speaking engagements and sharing at various opportunities. So we're glad what you do for us in this forum, and we're also glad what you do for us in person. And I want to thank you for giving us this time today. And to our audience, we want to thank you for tuning in to this edition of Forever Young. Our subject has been mental health. If you know someone who may not have seen this segment, tell them about next week's show, because we're going to be back, and Dr. Stewart is going to be back to talk to us some more. So on behalf of our guests, Yolanda Seals-Stewart, Gene Hendricks, the Hope TV staff, our executive producers, Dr. E. Dewey Smith, Cammie Tappan, who's behind the stage making sure that everything works, and even in her absence, Dr. Sharon Mitchell, who really puts these shows together for us, finds out talent, and helps us produce these shows. We want to thank you for tuning in. And we want you to remember, you're as young as you feel, and you're forever young, because age ain't nothing but a number. So for Forever Young, I and the rest of the Forever Young team, I'm David C. Linton. We'll see you next time. Take care. Bye now.
Bye-bye.